Hi guys, this is Chris from Luna's Masahe. I specialize in lymphatic post-op care. And so today, our video today, we are going to talk about fibrosis. So what is it really? What is fibrosis? Why is this happening? When this start to build up? And can this be avoided? Does lymphatic help? The answer is yes. It is a big help actually. So now let's talk about fibrosis. Fibrosis is the formation of excess fibrous connective tissue like scar tissue in the body, often as a result of injury, inflammation, surgery like post-surgery, like surgery like cosmetic surgery, like tummy tuck, liposuction, or any body contouring, okay? So fibrosis can form under the skin in areas that have undergone those cosmetic surgeries, just like what I mentioned. So why does fibrosis happen? So fibrosis is the body's natural response to injury. Okay, what are those injury? Those tummy tuck, liposuction. Again, I'm gonna repeat. Okay. Now, imagine during the surgery, your tissues are cut, right? Suctioned or manipulated, and then triggers inflammation and fibroblast activation, and then producing collagen to repair. So, in surgical recovery, fibrosis can restrict lymphatic flow. So, when if lymphatic flow restricted, what will happen? The fluid can build up to some areas, and when that build up and it will not be guided to supposed to be where it goes, then can build up and then it can harden and it become fibrotic. So that's where lymphatic massage is very important. So I do not know why some other surgeon do not tell their patients to seek for lymphatic therapist, okay? It's not gonna hurt them. It's just gonna improve their work, and their patients will thank them if they recover beautifully, right? So I just have no ideas what is the problem of these other surgeons out there, okay? Now, so this fibrosis, it creates irregular contours areas under the skin, okay? So this is not really pretty, okay? So now, when does fibrosis starts to build? Fibrosis can begin forming as early as 2 to 3 weeks, okay? 2 to 3 weeks. So if you wait 2 to 3 weeks before you seek your lymphatic massage, the fibrosis starts forming already. Okay, so not only you are giving your body a hard time to heal, you're also giving your therapist a hard time to help you, okay? Because she will work so much to break that fibrosis. Now, so fibrosis can start forming 2 to 3 weeks post-surgery, especially if lymphatic drainage is not performed, if there's fluid build up. So what I'm trying to say is seroma or hematoma, okay? Now, I created a video about seroma, okay? And it's in my YouTube channel. So if you need a link, if you need a video, you want to watch that, and I can send you a link. So just comment below in this video. So if there's poor compression used, okay? So when my clients come to me, and I always tell them, you need to wear compression, you need to wear compression. It has to be really good compressed, I know it's not very comfortable, but your body will thank you for it, trust me. Now, if the area isn't mobilized properly, yes, if it's not mobilized properly, meaning if the person that's giving you a lymphatic massage and do not know what she's doing, she's draining it to the wrong way, and then what's happening is it can only clogged up Okay, so you have to know the anatomy of lymphatic system. It's very important. Now, if not addressed early, the fibrotic tissue matures and it becomes hard over time, becomes more difficult to break down. Then some patients, they actually seek for another surgery. Okay, so you do not want that, right? Another expense, another recovery, and another pain. So let's avoid that. Now the question is, can lymphatic drainage help avoid fibrosis? Oh yes, it can. Manual lymphatic drainage is one of the best preventive tools to avoid fibrosis during the first 6 weeks post-op. Okay, some of my clients, they even come here very earlier than that. Okay, because remember what I said earlier, fibrosis start forming 2 to 3 weeks. Okay, now lymphatic massage reduces swelling and fluid buildup. Now, I am not talking about those lymphatic massage that I don't know what they're doing, that they will dig into the hole and pushes the fluid externally, right? I'm not talking about that, guys. That is not lymphatic. I don't know what is that, but that is not lymphatic, okay? I do not know what is the name of that. So lymphatic massage keeps tissue mobile and oxygenated. It prevents the buildup of protein-rich lymph. That is our lymph, right? Contains rich protein, okay, and which can lead to fibrosis if it's not drained properly, if it's not mobilized properly. Now, lymphatic massage supports immune and healing process. Yes. And the question is, does it hurt? No, it does not hurt. It's very soothing. It's very relaxing and it feels good. My clients, when they come here, they go to sleep, okay? They snore like a baby. Okay. Now, if fibrosis has already formed, how is it treated? Okay. Now, let's come to this. I have a lot of clients 4 years after the surgery, they have not gone to lymphatic massage. They come here and they seek help. Okay, they say, "Can you still help me? I have this and I have that." Yes, of course, it can be fixed, it can be treated, but it's gonna take time. It's not gonna be done for just 1, 2, 3 sessions. Okay, now. Fibrosis can be softened and reduced, yes, but requires consistent treatment. Modalities include manual therapy. Then you're gonna do some hard work, okay? It's not gonna be just lymphatic because it got hard already, right? Now, deep tissue, myofascial release, specific post-op massage techniques like you can use cupping, rolling. I even apply red light therapy. You can do machine as well. So we'll discuss about that more, okay? So you can use cupping or vacuum therapy. Lifts the fascia. The purpose of this is it lifts the fascia and softens tight areas. Then it also improves blood flow to fibrotic tissue. Okay, now ultrasound therapy, you know, the cavitation that they do, the body contouring, yes, that can help. Breaks down scar tissue using sound waves, stimulates cellular regeneration. Now, there's also endermology that can help, okay? Mechanical stimulation that improves lymph flow and tissue mobility. I do not do endermology here in my work, but there are some that does, and that is a great machine as well. Especially effective in post-op fibrosis, so endermology can help in those, okay? Radio frequency hits the tissue to stimulate collagen, remodeling, soften and evens out scared areas. Yes. Now, I will show you the picture of this fibrotic areas, the difference of have a fibrotic and no fibrosis, okay? So how many sessions are needed to treat fibrosis? So, I don't know if this is correct here, what I've said, I saw here, but based on my experience, I do not agree with that, with this chart here. That is, I found this online, but I do not agree with this. It says that this depends on how early or severe the fibrosis, but based really on my experience, This is just not much. Okay, now mild early stage 1 to 2 week, you need at least 3 to 6 sessions. I would go to 6 sessions. Trust me, you need that much. Now moderate 1 to 3 months post-op, and you have fibrosis is because you never did lymphatic massage. Now the treatment sequence frequency in this is twice a week. Okay, twice a week. Now 6 to 10 sessions. 6 to 10 sessions. Now if it is severe, older than 3 to 6 months, now we're talking about really hard there now. Okay, so you need to do at least 3 times a week. 10 minimum, 20 is actually a good package. Okay, and then you can do the contouring, and you can really do flushing and smoothing the area. So I would go for 20 sessions. Now combination of therapy like manual lymphatic drainage, cupping, and radiofrequency shows faster and better result than this. And I even do red light therapy really in my office here, and it really does wonders. So yeah, I do manual lymphatic drainage, cupping, and I even do rolling, lipo rolling in the radiofrequency, and yeah, I do all that stuff. So it works. It really does. It takes time, but it works. So let's summarize this video. So fibrosis is the buildup of scar, like tissue after trauma or surgery, like tummy tuck, liposuction, and it starts to form within weeks if lymph flow is poor or compression is lacking. So manual lymphatic drainage helps prevent fibrosis when it starts early. Okay, so treating fibrosis requires combination of manual and machine-based therapies, and results vary depending on consistency and severity. So yeah, that's why those surgeons that recommend their patients say, book a lot of lymphatic drainage. I salute the surgeon. When your surgeon say that, that means your surgeon care about their work and about your recovery. Okay, they care about your clients. So when the surgeon do not mention about lymphatic massage at all, I don't know. So you need you need to seek for lymphatic massage, because they are not the one going to suffer the lumps and bumps in the hard areas. It's you, and you are the one spend a lot of money, and you are the one in pain. So it's your job to find a professional lymphatic therapist that has a lot of experience, that going through all this treatment and see the result. Okay, yeah, this is your body, so you have to take care of it. So I just created this video because a lot of people, a lot of women that spend a lot of money, and they what they get is lumps, bumps, hard, and this and stuff. And then they say, I look way better than this before I had surgery. Yes, of course, I believe you do probably do. And now you got these bumps and lumps and stuff, and those are just build up fluid that was not mobilized properly. So again, if you go through surgery, make sure you arrange already plenty of lymphatic massages to certified lymphatic therapists. It's very important for your recovery, so you look pretty and smooth. Okay, all right, again guys, this is Chris from Lona's Masahe. If you need lymphatic massage, comment below and I will hook you up. Have a good day, everyone.